The purpose of this video is to discuss the topic of genetic profiling of individuals by the age of 18. We'll discuss the pros and the cons, and then we're going to have a debate about it. So on the pro side of it, there will be a decreased incidence of adverse drug reactions and toxicity reactions. There will be a decrease in misdiagnoses. Also, there will be accurate diagnoses for future prescriptions. There will be a decreased risk of cancer, as people might take better care of their health by getting more checkups and better lifestyle choices. It can help patients make more informed decisions regarding their health. Some examples are a negative result can eliminate the need for unnecessary checkups or screenings, avoidance of ineffective treatments, eliminating hospital admissions due to the aforementioned, decreased cost of toxicity management, and positive results can direct patients toward prevention strategies, monitoring parameters, and treatment options. It can help people with decisions regarding children or having children, including the risk for genetic conditions. It can psychologically prepare a family for an unborn child that would have a genetic condition, and also think of other ways that they can receive a child, such as adoption or using a surrogate. Newborn screening could be performed shortly after a child is born, which would identify genetic disorders early in life so that treatment can be started as soon as possible, which would make it so the family does not have to wait until symptoms show up or the child becomes at a critical point in their health before they actually initiate some sort of treatment. Why by the age of 18? It could be the patient's age when they start meds. Also, minimal physical risks. Most tests require only blood samples or buccal epithelial samples. It provides a sense of knowing, meaning that the family or the patient has a sense of relief. Uncertainty brings anxiety, so that when they actually know what they might have, they are more relieved because they can plan ahead for it. Even if the news is bad, at least they can plan ahead and take action about it if they want to. And if the news is good, then they can have a sense of relief. On the con side of it, they are expensive. There's really no way to get insurance to pay for it as is right now. So that it's going to have to be brought up to the insurance companies over time that it will save money in the long run, because the hospital admission savings will outweigh the savings that they get from not running the test, but then having to treat the patient when the patient decompensates or has some sort of exacerbation or toxicity. The risks of the procedure is during prenatal testing, samples of amniotic fluid or tissue around the fetus need to be collected, which runs the risk of a miscarriage. There's also emotional and social trauma that can occur during the process. People may feel angry, depressed, anxious, or they might feel guilty about the results. It might result in tensions in families. And for example, if an 18-year-old gets testing done and they receive positive results for condition X, it indicates that one of their parents must also have a gene or a source for condition X. Genetic testing could result in employment discrimination and also insurance discrimination, so that if a condition is now known, then they could be denied coverage, they could be denied employment due to potential liability issues. Hopefully this is a lot of food for thought, and now we will debate the topic at hand.